and the operation theater for cataract surgery. They lived in the first floor. And they were available to the patients whenever they needed. And whenever they had a cataract surgery, their spouse assisted them. They brought down the cost of cataract surgery to a level that anyone could afford it. And that made the magic. They took the cataract to community and they brought down the cost. And this is what will happen in every aspect of healthcare in India. And we are going to redefine how the healthcare is delivered for the rest of the world to follow. Why I am so bullish that India will do something which no other country in the world could do it. Because you may not know that largest amount of money in the world today is spent on healthcare. Global healthcare, and if I ask all of you business school graduates, students, which is the largest industry in the world, you may not know that the largest industry in the world is the healthcare and wellness industry. It is as big as the food industry, which feeds all of us. But after spending $15–16 trillion, less than 20% of the world's population has access to safe treatment. We have to change it. Now, India will show the world how this will happen. And I'm going to talk to you about few pivotal shifts happening in healthcare, which will make it happen. First thing is, it took us 60 years to create 55,000 medical seats. But our current government, in the last 10 years, added more than 75,000 medical seats, just in 10 years. Now, the Prime Minister wanted, during the last Republic Day speech, he mentioned they want to add 70,000 additional medical seats in the next 5 years. So we are already producing the largest number of doctors in the world. We will be producing doctors for the world. That's the first thing. The second thing, similarly, the nursing colleges, paramedical education, everything there is a thrust on increasing the number. So we will have adequate number of doctors, which are in short supply today. And you're also aware that we are the pharmacy for the world. India produces by quantity the largest quantum of medicine for the whole world. We have got doctors, nurses, technicians, we have medicines. Now, healthcare will be completely transformed with the digital platform powered by AI tools. If there is one industry which will have the maximum impact of AI, is medical industry. Around 5–7 years ago, in my presentation, I was talking to my colleague doctor, stating that smart software will make smarter diagnosis than the doctors. And it is going to take 5 to 10 years, even though I knew it would happen much earlier, because I didn't want my colleagues to shoot me down. Today, our team in Bangalore, our AI team, they created an application in AI. You just show the ECG and a photo of ECG. And the AI tool will give you the pumping action of the heart. That's the ejection fraction of the heart. No doctor in the world can see the ECG and say that the pumping action of the heart is 50% or a 60% or a 30%. And it is accurate enough to the extent of nearly 94%. Every aspect of healthcare will undergo dramatic transformation. We have spent huge sum of money in the last 22 years in building a digital platform. And About 16% of the heart surgery done in India is done by us. And we need this advanced digital platform. Our hospitals are all paperless and smart. Now, 80% of the hospitals across the world do not have digital platform or electronic medical records, or what we call as the EMR. 80% of the hospitals do not have it. It is too expensive for them to have it. Now, about a year ago, we decided that our digital platform should become like iOS or Android in delivering our consumer life. It should be delivered as a platform for delivering healthcare. So we want this to be available to any hospital, anywhere in the world, and they can pay whatever they can afford to pay. And if they can't afford to pay, we will give them free of cost. Like Sai Baba's hospitals and many charitable hospitals today are using our digital platform. Now, I just want to give an idea about how this dynamics works. Few months ago, the CEO of one of the charitable hospital, I gave the software free of cost. He wanted to meet me to thank me for giving them the digital platform which transformed the way that hospital runs. He asked me a very simple question on why I gave him the EMR free of cost. I told him that if I asked him to pay, he won't have the money to pay. But then I asked him two questions. I asked him, by giving him our EMR free of cost, have I become poorer? No. Then I asked him a second question. If I didn't give him the EMR, our EMR, free of cost, will I become wealthier? No. This is the power of converting atoms into bytes. If I have 1 kilo of rice, I give my half a kilo of rice to you, I have lost my half a kilo of rice. I built the EMR to take care of my patients. I can give it to the whole world. I still have what I have. They will also have what I have. This is the power of converting atoms into bytes. And this will have a massive impact on a country like India, which generally is built on the concept of sharing is caring. And this is a very, very powerful tool. The other transformation which will happen in India is large-scale infrastructure for patients to undergo annual health checkup. Today, unfortunately, not many people go for the annual health checkup. And this annual health checkup can dramatically transform the entire delivery model of healthcare. I'll just give you an example. Every day before 7 o'clock in the evening, every day in India, before 7 o'clock, few thousand people will have a heart attack. Maybe 1 lakh people, because we are 1.4 billion people. Few thousand people will have a heart attack. 10% of them will die even before reaching the hospital. Every day. Every day, before 7 o'clock in the evening, few thousand people will be told that they have advanced cancer for which there is no cure, and they're going to die every day. Now, I will give you the data. Our life expectancy is about 73, 74 years. If somebody dies at the age of 40 or 50 or 60, it is called as premature death. If you look at the cause of death, 33% of the death is due to cardiovascular disease. When you hear somebody is dead, there is 33% possibility in any part of the world he died due to cardiovascular disease. 17% of the death is due to cancer. That means 33 plus 17 is 50. 50% of the premature death happening at the age of 40, 50, 60, can be eliminated if people go for an annual health checkup. In 60 minutes, we can do the carotid, all the blood tests, carotid Doppler, echocardiogram, CT scan of the heart, and ultrasound of the abdomen, and a CT scan, mammogram, pap smear. Everything can be done in half an hour. So, why this doesn't happen? This doesn't happen because very, very few Indians know that how fit they feel has nothing to do with how fit they are. I see some youngsters sitting there. I just want to you to Google FIFA, FIFA, Federation of Football Association, and then you write cardiac arrest. Then you see series of articles, and you will read that in the last 4 years, just 4 years, 617 professional footballers had cardiac arrest during practice session. Just 4 years. This is what is documented. Undocumented cardiac arrest among the professional footballers will be a lot more, maybe 10 times more. I want to ask all of you, how many of you are fitter than a professional footballer? So, when I say that, doesn't matter how fit you feel, you have to go for an annual checkup. I am producing the data, I'm just telling you the data. Okay? So, if the whole country goes for an annual health checkup, most of the diseases like cancer or heart problem, everything can be, like an early stage cancer can be cured with a simple surgery. But end stage cancer, you may spend millions of dollars. In the end, you have dead body in hand. So this is the power of an annual checkup. And this should be available to everyone at a price what they can afford. The other shift which will happen in India is everyone in India will have a private health insurance. How this is going to happen, or why existing health insurance hasn't made the impact it should have? That's because there are three important stakeholders in delivering healthcare. One is the hospital, second one is the health insurance company, and the third one is the patient. Hospitals do not trust the health insurance company. Health insurance companies do not trust the hospitals. And the patient doesn't trust both parties. And those two parties don't trust the patient. So essentially, there are three important stakeholders in delivering healthcare. They don't trust each other. In any business, if there are three stakeholders who do not trust each other, that business cannot be scaled up. That business will never remain viable long term. Something has to change. what change will happen? About a year ago, with the reforms in insurance, we could become, as a hospital group, as a health insurance company, we are the first hospital group to become a health insurance company. Now, what difference it makes? It makes a big difference. Today, as I said, about 16% of the heart surgery done in India is done by us. More people develop heart attack, it is better for my business. But when I become a health insurance company, I will work very hard to make sure that people don't develop heart attack. And that is the only way I can save money. So then my interest and the consumer interest is aligned. Then the magic will happen. That is the first change which is happening now. Like us, many hospitals will go in that direction. The second major shift, what is going to happen, is that the Reserve Bank of India and the IRDA, Insurance Regulatory Authority, and some banks are evaluating the option of launching health savings account. Health savings accounts are like a zero balance account like Jandan insurance. But the money kept in that account can be used only for paying for the health insurance or for the medical purposes. There are about 400 million unorganized healthcare workers. Unorganized workers in the country. Gig workers, farm laborers, construction workers. They don't have a health insurance. Now, it is a matter of time before 400 million unorganized workers will have a health saving account. Now, what is the impact? Like today, the gig workers delivering ice cream to your house at 10 o'clock at night. So you are grateful to the service. All you have to do is to tip them 50 rupees and the money will go to the health savings account. Whenever you are happy with the maid or your driver or somebody servicing your house, you tip them and they waste that money. Instead of tipping them directly, you tip that money to their health savings account, and at the end of the year, they will have enough money to buy the health insurance. But your idea of a health insurance is that, oh, the premium will be 15,000, 20,000 rupees. No. We are in the process of launching a health insurance for unorganized sector with a premium of 3,500 rupees, which will, for a year, it will cover them up to 3 lakh rupees. Now, imagine 100 million gig workers have a health savings account and they buy the insurance by paying, they won't pay 3,500 because their employers or some donors will give about 1,000 rupees. If they're covered up to 3 lakh rupees, we have a assured healthcare coverage for 100 million workers to the extent of 30 lakh crore rupees, which is more money than most of the country's GDP. And this is the power of a country called India. I have many other pilots to talk about, but unfortunately there is no time. I'm extremely grateful to all of you for giving me the opportunity and for your patient hearing. Good luck and God bless.
Thank you, sir, for such an insightful session. We really look forward for the opportunity to host you in our campus in any next moment where you can join us. And with this, we come to the end to this insightful keynote session. Thank you, everybody, for joining us here today.